surgical extraction on tooth number 3. Okay?
That's on top.
Yeah.
Next.
So, first let's set up for tooth number 3. Okay? Well, I'm going to keep this stuff out. And I need a forceps for tooth number 3.
151?
Okay?
No, 150.
So that's going to be my 150 or what?
Or the horn. The horn?
88.
Is it 88?
Right.
Right, yeah.
Okay.
Oh, the ones with the 3 prongs?
Yes.
Okay.
What is it called?
It's an enclosure.
And what
Trifurcated.
number is this?
Roof 3 roots?
3 roots.
But can we say 88?
This for 3?
R, because it's right or left.
2, 3, or what tooth did you
Number
say
3.
this? Really? You didn't have that on the setup.
Testing us, right?
You didn't have that on the setup.
All right, continue.
What's that up?
When you just took it out.
Huh? Took what out?
When we took the pictures and you said, oh, it's
No,
for
I
tooth
didn't
number
say
3.
what tooth.
You didn't?
No,
I could have sworn you said
You
3.
have to pick your forceps for whatever tooth you're working on. That's why you have to know your forceps.
But that's the basics.
I just
the
did a
reset.
setup just for, in general, for you to know when I asked for a surgical setup. Okay? So now this is for tooth number 3.
The ring tooth?
First thing is patient gets numb, right?
Mm-hmm.
All right, after patient gets numb, doctor's going to go in there. All right, we're going to switch it. We're going to switch it to the lower.
Oh, gosh. You just did that because it's convenient.
Yeah, we're going to do the 151. And that's the one I'm going to use, 151.
Do you want to 51? That's universal.
You can use a cow horn. You can use the 151. 151. 90. Right. All right. So first step, periosteal elevator.
Separating tissue.
Okay. The periosteal elevator retracts the tissue back away from the tooth. They have to be able to get a good grab on the crown of the tooth. Okay. So half the time the teeth are fractured off. So if they don't have any room to grasp with the tips of their forceps, they have to create that. So they'll retract the tissue back, okay, with their periosteal elevator. After they've done that, okay, then they're going to go ahead and elevate. When they elevate, they go in approximately, okay? Now, I'm going to turn it towards which tooth I'm going to be taking out. There's a ditch. You guys see the ditch in that?
Can
See
I see
it?
the ditch? Okay.
See a ditch? All right, so it goes in, the ditch goes towards that tooth. And they rotate,
Lifts it up.
and it lifts, okay? It's going to lift that tooth out of its socket. So what it's doing is tearing it from its ligaments, just to loosen it,
And that's what you get.
okay? Down in here. Bone does not flex, okay? So half the time there's a problem because it'll break. The roots of the teeth will break because there's no flexing in bone. So they have to slowly work at it. If they go too rough and hard, they're just going to fracture it off, okay? So they're going to go in, they're going to rotate, lift it up a little and slowly. After they do that, they're going to try to go ahead and use their forceps. See how it's facing down and it has a good grip on it?
And that's the...
Okay, and they're going to rock it slowly back and forth. They may even turn it,
What forcep is that?
okay? 151, Mandy.
151.
Okay? So they'll rotate it and they'll go back and forth because they're trying to flex it to make it so where it can come out. Yeah, I think I'm going to tear it off the...
I can hear it.
Okay? Let's say the crown completely fractured off. Okay? When he was trying to take it out. Now we have no crown. Where's the screwdriver? Here, I'll use anything. I don't care. Just give it a shot.
In the box, probably.
What's this?
1001 uses for a surgical curette. Oh, yeah.
That's good. Quiet is good.
Oh, then you fall asleep.
I don't know.
It's just like when you lay in the
I don't
dark.
get quiet very often.
You fall asleep.
I
I can't sleep with the TV on.
I have to.
I can't.
I didn't used to
I have a
it.
pillow over my head.
You
My
have like
fiance
a
is
white
home.
noise
Yeah,
all
I got
time.
used to it.
All right, so the tooth fractured off, right? Okay, so we have like the socket. Let's just say there's a tooth in there. We got to get it out now. Okay? So let's say a piece of it cracked off on the buccal surface. So it's towards the cheek over here, right? The piece is lodged in there. What he's going to do, he's going to take this side that's pointing to go into the socket and try to get that piece out. Okay? If it broke on the lingual surface, he's going to try to take this one that's pointing towards it to go in that socket and grab it out. Okay? If these don't reach, because they only go so far when you have remaining teeth, okay? He's going to go probably with his root tips. They're thinner, they're skinnier, they're longer. Okay, let's say the very end of the root, the way down here is stuck. He's going to go in there and he's going to dig and pull it out. Okay, so he has to work at it with every instrument here. Okay, these go in further. That's why they're called root tip picks, because they'll get the roots, okay, that are way down in there. Okay, after he does that, let's say the bone is kind of, you know, it's not smooth. Okay, he's gonna take or he can use his rongeur to go ahead and take a piece out. Let's say he loosened it with his elevators. He can take the little thin heads of the rongeurs, go inside and grasp the piece and pull it out. Okay? If that doesn't, let's say his bone isn't smooth, he can take the rongeur and he can crack the little pieces of bone off to make it smooth. Okay? After he does that, he's going to go ahead and take his surgical curette and clean out the socket while you're suctioning it all out. The pus, whatever's left in there. Ooh, what's in there? Okay, so he's going to be scooping it all out.
In my eye. No, you didn't.
After,
Even though the bone is all cracked up and he's scooping it, is he scooping the bone out too?
yeah, you're suctioning the bone. You're suctioning all the extra pieces out. Okay? So you've suctioned all that out. Okay? He scooped it out. Now you just take your 2x2s. Take 2 of them, wrap it into a square, put it onto the socket. Okay? So you got to make sure you take the 2, wrap it into 4. And I know on the video he just kind of shoved it in there. Don't do that. Okay? He's going to place it right there. You apply pressure. Tell patient to bite down. Watch your fingers. Okay?
How long do they bite down?
Patient will bite down hard. You tell them to bite hard to stop the bleeding.
Minimum 30
They'll be
minutes.
sitting there for a few minutes after the extraction is done, and you're going to have them bite for a good 3 to 5 minutes. Hard. Before they leave the office, you're going to take this gauze out.
Put a new one in.
Okay? Toss it. Get a new one. Okay? Have them bite down on that, and then that's when you're going to give them the instructions after they've sat for a minute and they're coherent. All right? And you're going to give them all their instructions. No spitting, no drinking alcoholic beverages, no smoking, no drinking through a straw, no spitting, no vigorous rinsing, no too hot, not too cold of foods. You know what I mean? All of that
Just don't
is
eat.
the instructions.
Just don't eat.
That's the instructions that you have to give them. Because if they come back in a day or two, you know why.
Okay.
If you see them at the front.
With what would you?
Oh, look who just walked in. They got dry socket.
You spit.
Yeah. So you know why they're back in the office. That or, because stitches, when they get sutures, they don't come back for a week.
5 to 7
Okay?
days.
So if they come back 2 days later, you know it's not for that. All right? You guys get it now? Okay.
My question.
Mhm.
The high speed and the surgical
All right.
burr.
High-speed surgical burr. If the piece, let's say the tooth's completely fractured off and the tooth has decay. Decay is soft, right?
Yes.
Okay, cavities, they're soft. You can just scoop at it and it will come off, okay? It'll just scoop onto your spoon. That's how soft it is. If the tooth is completely broken down and it's a lot of decay, every time they go to use an instrument, it's going to fracture off. So their goal is to cut that tooth in half completely to where there is no decay. They'll section it. Instead of trying to take it out whole and making a bigger mess for them because they have to take piece by piece by piece by piece, they're just going to go in there and they're going to surgically cut it in half and take it out in 2s instead of 15s. Okay? So they'll cut it in half all the way down to where there is no decay. After it has a gap in it from the burr, then that's when they're going to start, using their pieces to take it out in sections. Okay? If they don't do it that way, let's say it is fractured down at the gum line, okay, so it's flat, then that's when they're gonna probably use the handpiece, go in there, and same thing. They're just gonna section it. So the handpiece is strictly for sectioning it, or if they have a piece or a piece of bone that's not doing what it needs to do, they'll remove it. Just like when they do impactions, full bonies. A full bony impaction is under the bone completely. Usually it's wisdom teeth. So if that happens, they have to cut away bone to get to the tooth.
Or in my case.
So they're gonna use the
That
high
root canals.
speed to remove the bone. Okay, and that's why you have your handpiece.
I had 2 failed root canals and it fused to the
Good.
bone.